Hi everyone, this is Evan with MEND Physical Therapy, and today we're going to be talking about pain. Over the next few weeks, we're going to be doing a deep dive into what pain is and how we experience it. It's a fascinating topic. So this series is for anyone who experiences pain. There are a few select few genetic disorders where people don't actually experience pain. For the rest of us, this is for you. And I think we can all agree that having some kind of understanding over something gives us some degree of power. And I think that pain is something that if we can understand it better and have power over it, that'd be extremely helpful in our daily lives. So let me be clear. At the end of this series, you're not going to be running around doing whatever you want totally pain-free. Pain is still really useful and effective in our bodies. Let's face it, without pain, we would be dead. Without our bodies telling us the dangers in the world, we would not survive. We should be grateful for pain. My goal for you at the end of this series is for you to have a solid understanding of what pain is so we can more effectively listen to our bodies and respect what our bodies are saying. So let's nerd out for a few minutes. Okay, so the first thing we're going to talk about is some basic anatomy of the nervous system so we can understand how our body takes in and then processes information, and especially pain. And we're going to do that so we can understand that what happens out here in our body is different and a different event than what happens in our brains as we process pain. And so, let's go to the drawing board. First rule is you're going to have to be patient with me on my drawing skills. If you get caught up on that, it's going to be a long series for both of us, so be patient. Look, I even labeled things so you know what we're talking about. So we have thousands and thousands of nerves and different receptors in our body that are always trying to sense what's going on in the world. Today we're going to focus on two different examples of nerves. We're going to focus on fibers that sense touch and fibers that sense threats in the environment. These are the ones that are often called pain fibers, but really what they're assessing are threats in the environment and things that we should pay attention to. And the pain is going to happen when your brain actually processes what that information is. So let's follow the path of these nerves. And an example I want to go over is, let's say you're running out the door because you're late to work and you hit your elbow on the door jamb. So the receptors in your body are trying to make you pay attention to that elbow that you just hit. So those fibers go from your elbow to the spinal cord and then up to your brain for interpretation. So we can pay attention to this and attend to it. So this is the first example of how we can have some degree of control over the pain that we experience. And it's an example that probably a lot of you are pretty familiar with. What do you do when you hit your elbow on the door as you're running out? You immediately grab it and you rub it. That's like an instinctive response. What's really going on in that situation? Well, what you're doing is you're actually activating the fibers that sense touch, and those are overriding the fibers that sense threat or pain. So how that works is the fibers that go along for the ones that sense threat are traveling, you can think of them like a garden hose. It's a small tube that's not a lot of pressure. The fibers that sense touch, they're like a fire hose. A lot of information is going to go through them really quickly. So when you are rubbing your arm, what you're doing is you're activating the touch fibers, sending the fire hose rather than the garden hose. And your spinal cord takes care of this for you. It actually pays attention to the touch fibers rather than the pain sensation, so that you feel less pain up here. That actually helps with pain. So that's just one way we can actually have some degree of control over the pain that we experience, but where the real magic is right up here. So one question I always like to ask is, where is the pain center of the brain? We have a visual cortex, we have a sensory cortex, we have a motor cortex, all these different areas that are responsible for different functions in the body. Well, where is the pain center? The pain center is a combination of all different types of areas in the brain. There is no one pain center in the brain. And that's a really important concept as we understand more and more about pain. Some of the most important areas to pay attention to in the brain are areas like the hippocampus, the one that attends to memory. We also have the amygdala, the emotional response center. We have the frontal cortex that gives us more of our personality and how we as individuals respond to pain. And then of course we actually have the area that senses where our body is in space and what is touching our bodies. When you combine all these areas, that is when you develop your pain experience. And it's important to pay attention to all these different areas. You need to have memories of sensations so that you can store those for later use. When it's the middle of the night and you feel something lightly touching the back of your shoulder, your brain needs to assess whether that's a threat or not. Is that a spider crawling on me? Or is that just a little hair that's being blown by the wind and making that sensation? If we always reacted like there is a spider or an imminent threat, it would be exhausting and it would be a highly inefficient system. Likewise, if we never responded like there was a threat, that would obviously be very dangerous for us. So that's why it's really important to integrate all the different areas to create an experience of pain. Because let's face it, our brains have a lot to pay attention to. They're taking in a ton of information, and mostly what they're doing is filtering it out so you don't have to pay attention to it. You don't have to think about the shirt that you're wearing touching your shoulders right now, because that's useless information. But now that I brought your attention to it, maybe you're actually thinking about it. And this is crucial when it comes to pain. I'm sure we've all experienced small cuts on our body or bruises that we didn't even realize that we had. Well, when you got that bruise, you got that small amount of tissue damage, your brain was focused on something else, and I'm sure it was more important than that small amount of tissue damage that you had. But then it can get a little more complicated, because sometimes the brain pays attention to tissue damage more than it should. And this is based off of things like our past history, our emotional response. What does it mean to you as an individual to hurt your knee in that particular way? Does it mean the end of ski season? Does it mean you're not going to be able to hang out with friends? Is it going to negatively impact your social life? To some people, that's everything. To some people, I just kind of hurt my knee. I'll be fine the next day. The same amount of tissue damage will be experienced differently by different people because of all the different areas up here. What about the person that's starting to experience that same exact type of back pain that your mother had, and you know the condition that your mother's in right now is not very good because of her back pain? That means something different to you. That's going to activate all those different areas of your brain and is going to trigger a greater response to that same amount of tissue damage. Our beliefs and social norms and experiences affect our pain, and that all happens right here. It serves an important purpose, but just like everything else in the body, it can go too far and start to cause problems. And this is where I actually lose some people. People think, he doesn't believe me, he's just saying all my pain is in your head. The most important thing to remember through all of this is that all pain is real. Whether it's from stepping on a Lego or an emotional trauma, whatever your life experience is, all the pain that you are experiencing is 100% real to you, and don't let anyone take that away from you. A lot of people in chronic pain have not been believed by their spouses or by their friends because they think it's all in their head. And this can be an awful experience for that person. So just remember, all pain is real. It's 100% unique to you, and don't let anyone take that away from you. Okay, so now you're going to get some homework. I want you to think about the last time you experienced pain, and how painful was it, and what was the context you experienced it in. Now think of the last 3 times you've experienced pain. What was the context, and how painful was it? See if you can figure out on your own if your context and your experience affected the level of pain you had. And then as you move forward over the next couple days, pay attention to the next few times you hurt yourself. What's going on? What's the context? And how does that affect my pain? See if you can tease out your own pain experience based on your previous experiences and your beliefs about pain. It can be a pretty powerful practice to gain an understanding and a little bit of power over the pain that you experience. So give it a shot. So thanks guys for listening to the first episode here. I know we went over a lot today, so please post any questions you have on the comments. Be happy to answer them, and I look forward to going a lot deeper over the next few weeks into all the different concepts of pain. It's going to be a lot of fun.